Welcome, everyone. We'll get started in just a moment. Well, I know a few people are still joining in, but we're going to go ahead and get started. Welcome and thank you for coming today. I'm Dr. Clarence Braddock, a professor of medicine, Vice Dean for Education in the David Geffen School of Medicine, and Executive Director of the Anti-Racism Roadmap in this school. I'm delighted to welcome you to the very first installment of a new UCLA Health Equity and Justice Action Series. The Action Series really grows out of the efforts of both the School of Medicine and UCLA Hospital and Clinic System in our respective efforts with the Conversations with Leadership and Leadership Dialogue. And we're joining forces now for a new series to seek solutions that advance equity and justice among our staff, faculty, trainees, students, patients, and communities. I'm grateful for the partnership with my colleague and our new UCLA Hospital and Clinic System Chief Health Equity and Diversity Inclusion Officer, Dr. Medell Briggs-Mollinson. As many of you know, Dr. Briggs-Mollinson is still a practicing clinician and in the emergency department, and actually on Fridays, she has her a regular shift, so she's unable to join us today, but sends her greetings to the group. Today's session is entitled Confronting and Addressing Anti-Asian Racism, Harassment, and Violence. And it's really in response to ongoing events, we're focusing on confronting and addressing anti-Asian racism, harassment, and violence today. We, the leaders of UCLA Health, are outraged by the uptick in incidents of anti-Asian racism, and we're committed to addressing it within UCLA Health and by extension to communities that we serve. In light of the recent killings in Atlanta, which sent shockwaves through the Asian American community, through our community, and really through the nation, I'd actually like to invite you to join me in a moment of silence to honor the lives lost. Thank you. The leaders of UCLA Health acknowledge that we cannot combat anti-Asian racism alone. We invite all attendees today and all your colleagues, friends, and the members of our community to contribute to today's discussion and beyond as we identify actionable next steps. Our three main objectives today are, first, to raise awareness of anti-Asian racism and its deleterious impact on individuals within UCLA Health and beyond. Second, to explore the contributing factors to anti-Asian racism. And third, to begin to generate a list of institutional, group, and individual actions that we can take to combat anti-Asian racism. I want to welcome and acknowledge the special guests and partners in this program today. First, Julian McNeil. Julian is an anti-racism program manager in the School of Medicine and will be our moderator for today's event. Dr. Manju Kulkarni, Executive Director of the Asian Pacific Policy Planning Council and a lecturer on Asian American Studies at UCLA. Karen Umemoto, Helen and Morgan Chu Chair, Asian American Studies Center at UCLA, and professor in the Departments of Urban Planning and Asian American Studies, UCLA. And Dr. Brandon Ito, Assistant Clinical Professor of Psychiatry here at the David Geffen School of Medicine. I'll now turn things over to Manju to provide us with additional context for today's work.
Hello, good afternoon, everyone. First off, I want to thank you all for attending today's session and for the organizers for putting it together. It's a real honor and privilege for me to be with you today, and especially to be with Karen, who represents one of our member organizations of APCON. APCON is, a coalition of over 40 community-based organizations that together serve and represent the 1.5 million Asian Americans and Pacific Islanders in Los Angeles County. Excuse me. And so together we do some of what I consider to be some of the most important work for our AAPI communities in Southern California. I do want to first acknowledge what happened in Atlanta on Tuesday and express my deepest sympathies for not only the families of the victims, but also for the community in Atlanta that's truly reeling for what has happened, as are many of us. And I also want to just add that, I also have the pleasure of being part of the UCLA community, having taught in the Asian American Studies department, 2 classes, one on the South Asian American community, and also teaching ethnic, culture, and gender issues in America's healthcare systems, and having served in the public health space as a health lawyer for 11 years. I bring that knowledge with me today. So next slide, please. So I want to talk about Stop AAPI Hate, which is a project that was launched by our organization, APCON, along with Chinese for Affirmative Action and San Francisco State University exactly a year ago today. The 3 organizations came together because we began to see really what was an emergence of anti-Asian racism and discrimination here in Southern California, as well as in the Bay Area. And so we launched our site doing a significant outreach to limited English proficient communities, as well as immigrant communities, and making sure that our reporting form was available in 12 Asian languages, including the ones mentioned there. Next slide, please. And what I wanted to share with you is really what we have seen over the course of the last year. I'm not going to read these incidents, but wanted to just share them as being representative of what we've received at Stop AAPI Hate. So you see in the left-hand top corner, a refusal of service from a ride-hailing company. In the middle, a story of elderly grandparents being accosted in their neighborhood, taking their grandchild on a walk. The one on the right is of a physician, probably similar to a number of you on the call who may have experienced racism like this physician did, just in an interaction with a patient. Beneath that one, example of an attack against an individual. The middle one actually received quite a bit of social media attention coming from a tech executive who not only used racist language, but weaponized the former president himself, saying that Trump is going to F you. And, similar comments have been heard by many of the victims from perpetrators referencing President Trump. And then the last one of the middle school child who was physically attacked and verbally assaulted on the schoolyard. This happened in early February of last year, before there was a single confirmed case of COVID-19 in Southern California. It's notable for that reason, as well as for the fact that sadly, by early February, the racism and hate had seeped its way into the mind of a middle school child who then perpetrated violence against another. Next slide. So in coming together and forming Stop AAPI Hate, we created the online reporting center, and within a few weeks received several hundred reports from across the country. That number grew over the spring, summer, and fall. And now into the winter, we have received 3,800 incident reports from all 50 states and the District of Columbia. We know that California and Los Angeles have experienced high numbers as well. Of the 3,800, 1,600 plus are from California and 360 from Los Angeles County specifically. while Chinese individuals, that is Chinese Americans, represent a plurality of about 40%. We know that others in the community, including Vietnamese, Filipinos, and even South Asians and Pacific Islanders have also experienced hate. Women have reported at roughly 2.5 times the rate of men, and 6% of our respondents are seniors and roughly 10% are youth. One point I wanted to really highlight here is that the vast majority are hate incidents and not hate crimes. And this is important for a few reasons. As we consider policy solutions, it's important to remember that 90% of what is reported to us does not involve an underlying crime whatsoever. So this is the verbal harassment that is protected by our free speech laws, as well as discrimination, which we consider to be civil violations and civil rights violations, but not actual crimes. So I want to point that out because, again, the media and even policymakers have unfortunately conflated the two. And one last thing before, as we switch to the next slide, 3,800 is a significant number, but when we look at the Pew study, we find that 3 in 10 Asian Americans reported to Pew that they have experienced some form of racial slurs, racist jokes. So when we look at the 24 million of us that there are in this country, that equates to roughly 8 million individuals who have experienced some form of racism, discrimination, microaggressions, et cetera. So as we delve into the data, we see that with the types of bias and discrimination, significant number involve verbal harassment. These are comments made, sometimes alone, and sometimes with physical assaults, with discrimination, and with other types of civil rights violations. You see that physical assaults make up 11%. Then we have what we consider to be those civil rights violations, the last 4, workplace discrimination, being barred from establishments or refused service, being barred from transportation, and vandalism and graffiti. Next slide. And so next we want to look at the sites of reported incidents. And so those, you see about 35% take place in businesses. So this should be a cause for concern. And this was true even when we were sheltered in place and individuals were simply trying to feed their families, get their prescriptions filled, buy toilet paper at big box retail. And so when we think of policy solutions, we know that businesses will need to be an important part of that. Then we look at public streets, public parks, and public transit as being the next most significant arena for this hate incidents and hate violence. Online incidents represent roughly 11%. And then finally, you see that the numbers and percentages at schools and universities is actually quite low. And we believe that's because they have not been fully opened up. We know in Southern California, schools are largely virtual. That's true in a lot of metropolitan areas across the country, or there may be hybrid situations. Similarly, universities, including UCLA, are still largely virtual when it comes to attending classes and so forth. Next slide. And then when we look at the targeted ethnicities, I mentioned this earlier, Chinese make up a plurality, and then we have Korean, Vietnamese, Filipino, and others. I want to point out 2 things here. The category of Asian is either individuals who are identify as multiracial or more broadly as Asian American and not tied to a specific ethnicity. And then also you see that we do have African Americans, Hispanics or Latinos and whites. And that's because on our site, we allow people to report incidents that they have witnessed. So they don't have to actually experience those themselves. One other point is that we do also allow individuals to report on behalf of others. So for example, the case of the elderly parents was reported by their adult child. Next slide. We know that this has significant impacts on AAPI communities and have observed an 155% increase in depression rates. I want to say here too that we have actually teamed up with the American Psychologists Association and have done a study of our respondents. That data will be released next month. But I can tell you the preliminary results show that there are, in fact, these increases, and that's not surprising considering how traumatic any of these are to the individuals who've been targeted. We also know Asian American community members are experiencing high rates of unemployment, as well as loss of businesses due to business closures. And finally, I want to just say that, we know that with anti-immigrant policies, racial profiling, those things that come from government, there's further stigmatization and scapegoating that's extremely problematic. Next slide. So I just want to point very quickly to some images and framing that's taken place over the years. We know that very early on in the 1800s, there began to be the propaganda of the yellow peril or the yellow danger. We see here also a photo of an Asian woman eating a bat. And then, of course, the article at the bottom, China is the real sick man. So the sort of framing, and I would say even a fertile ground that's been created even by our film industry. If you look at the movie Contagion and how it blamed that pandemic on and its origins on Asia, it's not surprising to see where we are today. Next slide. And this is, of course, just part of a bigger pattern. And I know that one of the questions I think that we have gotten is about, back to the last slide. Just some of what we've seen. We're very familiar with the Japanese American incarceration, but I wanted to point out too that there was also the dusky peril, which impacted communities like mine, the South Asian community that were specifically targeted in the early 1900s. We know that Muslim Americans have been targeted. There's a picture there of Vincent Chin, and also racist depictions, not only of the Chinese, but also of Pacific Islanders. And then as I close, I just want to point to, next slide, our four-pronged approach, which is to track and analyze racism through Stop AAPI Hate's Reporting Center. We obviously want to raise public awareness and engage in public education efforts, provide community resources as well as direct assistance wherever possible, and advocating for effective solutions at local, state, and national levels. I had the opportunity to testify before Congress yesterday to present our data to members of Congress and also discuss some of the solutions that we've outlined. And the last slide. And so we hope that this is really an endeavor to work together with all of you and our collaborative partners in the legal world, in community-based organizations, also in the health and mental health arenas specifically. And so these are sort of all of the various tools that we believe are going to be critical in moving forward. And the last two comments I want to make is that here in LA, we actually have a very innovative program called LA versus Hate. We're proud to be part of that. And it's where individuals call 211 or report on 211. They get direct case management services on hate incidents, not hate crimes. but then, and this is for all members of the LA community, not simply Asian Americans, but if an individual is Asian American or Pacific Islander, those calls then come to us. We provide direct support and assistance to those community members in linguistically and culturally appropriate ways. I also want to just encourage all of you to report incidents. There's really nothing that we consider to be too small or insignificant. This is the way that we understand the problem and develop those solutions that help all of us across all 50 states. And so before I end, I just also want to mention our collaboration with Translate COVID, and again with Karen and her team that have received funding alongside Stop AAPI Hate from the state of California to look at all of the impacts of COVID on our Asian American Pacific Islander communities. Last slide. Here's my contact information. And again, really appreciate the opportunity to share our data and our work with you today. Thank you.
Thanks for sharing that information with us, Manju. So if you're just joining us, I'm Julian McNeil, the Anti-Racism Program Manager here at the David Geffen School of Medicine, and I'll be moderating today's panel. To get us started, I want to make a few housekeeping notes, and then we'll jump right in. So first of all, to get us started, I will ask the panelists a few questions that were submitted in advance, but then open the floor for additional questions and reflections. If you'd like to contribute, please use the Q&A feature within Zoom, placing an asterisk next to your comment to indicate that you'd like to speak live. If there's no asterisk next to your comment, then I will ask that question or offer your reflection on your behalf. Finally, we'll be using the upvoting feature today. So if there's a question that you would really like to see answered, please upvote it, and we'll try our best to answer those questions with the most upvotes. All right, let's begin. So anti-Asian racism in the US isn't a new phenomenon. In fact, it has deep roots in this country. I'm wondering what's important for people to know about the history of anti-Asian racism in the US, and what are the implications for our work today?
I'm happy to take a shot at that. I don't know how we're trading off.
Right in. Yep, jump right in. Thanks.
Okay, and I just want to thank Manju for the great work that APCON is doing and Stop AAPI has been doing, and it was just so prescient of you to start this reporting center immediately after the coronavirus pandemic. You know, we became aware of its magnitude. So I think I'd like to just draw a parallel between some of these historic events and what's happening today in terms of how we can understand some of the sources and causes of anti-Asian hate or any kind of, you know, targeted hate against a particular group. So one of the, so there are kind of these underlying causes at least in the scholarly literature, dealing with these kinds of incidents. And then there are these triggering incidents, right? So that Pearl Harbor, the bombing of Pearl Harbor was a triggering incident. 9/11 was a triggering incident. But I think we need to pay a little more attention to some of the underlying causes. And I'm going to simplify these down to 3. So usually these things happen when there's gross inequality, and when a lot of those inequalities fall on racial ethnic lines. And when there's poverty and economic insecurity, and that there's that kind of anxiety and angst, where it's easy then for the second thing to kick in, which is political movements that turn those situations into scapegoating situations, blaming a particular group for a particular problem, whether it's unemployment, whether it's trade imbalance, whether it's, in this case, the coronavirus. And a group then gets targeted, and this kind of political momentum kind of grows, and certain, like in this current situation, kind of white supremacist organizations were empowered and emboldened, and those kinds of things just, lead to a cascade of events that I think bring us to the point we are today. And then I think the third influence is residential and social segregation that causes people not to be able to grow up their whole lives without even interacting or knowing people from many other racial groups. And even in cities, right, there's this kind of micro level segregation that takes place. And with proliferation of social media, sometimes we're only communicating, with a narrow band of society. And with the lack of ethnic studies education in our public school system, we're still getting a biased understanding of American history, of world history, and we don't really have that kind of grounded wisdom and full knowledge really to be able to interact and understand one another in the, with the depth that we really need to in such a multicultural society.
Thank you. In contemporary discourse, Asian Americans are often situated as model minorities, invisibilizing the harm caused by racism, harassment, and violence. How can we counteract the model minority stereotype and create a more accurate and more nuanced depiction of the Asian American community? And that's for anyone on the panel.
I could start. I think there are two ways, and I want to point out when that term was coined, which was in 1966 by Professor Peterson at University of California, Berkeley, or Cal. And so what he did was two things. One, he juxtaposed African Americans with specifically Japanese Americans, but then more broadly sort of contextualizing it in the Asian American context in two ways. One, to say that Asian Americans were a model because they were well off or doing better, I guess, sort of economically than African Americans. And then two, he really indicated that African Americans were a problem because they were demanding their civil rights, whereas Asian Americans were essentially quiet and sort of floating on those stereotypes of Asian Americans as meek, as silent. And so I think in terms of fighting that, we have to do two things. One is we have to refuse to be a wedge and refuse to be pitted against our African-American sisters and brothers. And two, because when we look at data disaggregation, we know that while some parts of our community do quite well financially, other parts struggle. And so by understanding the nuances of what falls under the Asian American Pacific Islander rubric, we better understand the needs and the challenges of our community members. Number two, what we need to do, though, is to also fight in that second way, which is to not be silent and not be silenced, right? Very similar to what Oprah said the other day. We cannot be silenced in this moment. And I think what's happening now is you are seeing Asian American Pacific Islander advocates speaking up and thankfully getting some of the attention that heretofore we haven't got. One point I want to make is the hearing yesterday, very interesting that there's not been a congressional hearing on Asian Americans or Pacific Islanders since 1987. So think about that. Despite our population, despite our needs, we have been silenced by our policymakers. And so this is an opportunity for us to overcome that and to not only claim our place in the American fabric, but to also talk about some of our needs and the policy solutions that we desire.
Thanks.
Just to add on to that, before starting, I just want to acknowledge and express appreciation for, members of the Black and Indigenous community who have been fighting for racial justice and advocating for not only decades, but especially over this past year. I want to recognize and acknowledge that, because that process has allowed this to rise to the national narrative and have this conversation today. In terms of the model minority myth, I think one of the things to remember is that the Asian American community is comprised of a very diverse and vast number of different ethnicities, different experiences, and different immigration patterns. And one of the ways that this minority myth can be damaging is that it presumes that everybody is the same and functioning well, which we know is not true. We know that the Asian American community has one of the biggest wealth disparity gaps within different ethnic communities. And so to dismiss some of the challenges of certain populations can be very harmful. Lastly, another one of the problems with the minority myth is that it presumes that actions or violence against Asian American communities is somewhat less urgent or less important. And we know from some of the literature that when these events are reported, they aren't acted on as strongly or as quickly versus hate events towards other populations.
Thank you for sharing that with us. I'm going to ask, I have a couple of questions for specific people on the panel, and then we will open it up for attendees to ask questions. I think we have about 13 questions so far, and a couple have been upvoted already. This next question is for Dr. Mamoto. And it's, what are some of the reasons that Asians and Asian Americans, particularly here at UCLA, might underreport incidents involving racism, harassment, and violence? And how can we make reporting easier for members of these communities?
I think there are several reasons for underreporting, and I'd invite my co-panelists to chime in as well. I think many people don't realize that there's a sizable undocumented community of Asian American students on campus. So I think like in society as in general, I think there are populations that are afraid of being seen for legal and political reasons. I think another is that I think there's so many of us who were trained and who grew up with that saying, the nail that sticks up is the one that gets hit. And there's still a lot of, and I don't know where, I think it comes to different groups differently. For my parents who were interned in the concentration camps in World War II, that was really instilled in us that, don't complain, don't be visible, because that's just going to get you in trouble. So I think reporting things is looking almost as like complaining about something. And that's something that I think we were taught, that you shouldn't do. And then I think there's just still not as much attention paid, on the campus as a whole to this problem and to these to the incidents. And I think we just haven't been on campus as much either. So I think there's a lot of outreach that UCLA and other universities can do to call attention to the problem and to invite people to really come forward, tell their stories, so that we could get a better handle on the situation and address it more effectively. Thank you for that question.
Yeah, no problem. Does anybody else want to add about reporting or underreporting? This next question is for Dr. Ito. We know that access to mental health resources is very important for targets of racism, harassment, and violence. However, data show that Asian populations tend to access mental health resources less than white populations. I'm wondering if you can shed some light on why that is and what are some of the consequences?
Sure, thanks for the question. So we know from the literature that Asian American populations access or utilize mental health services at a rate of about 50% less than their white counterparts. And we can think of many reasons, some of which Dr. Umamoto just referred to, which is in a belief or an idea that, things that happen either within the individual or within the community kind of stay with the person or don't get talked about more broadly. Another thing is just the pure lack of access and or availability of both culturally competent but community located mental health centers. We know that within the Asian American populations, the stigma around mental health is really significant. Asian Americans are more likely to be fearful about a diagnosis or accessing mental health affecting their jobs or their ability to maintain employment, and also the perception among peers. So I think all of these things contribute to the less utilization. The problem is that with this lack of access and with this decreased utilization, we see that Asian Americans more often come into the mental health system with a higher severity of illness. We know that for the age range of 15 to 24-year-old, Asian American females have the highest rate of completed suicide. And we know that for severe mental illness, the time between treatment and onset of symptoms is delayed by approximately 2 years. So all of these factors cause tremendous problems in accessing care.
Thank you. All right. So at this point, I want to open up the floor for questions or comments, reflections from attendees. We'll continue using the upvoting feature and the hand raising feature during this part. So if you would like to make a comment, please raise your hand or add a question through the Q&A feature. I will say that Manju has to depart a little early today. So I just wanted to make everyone aware of that. So if there are particular questions for her, then we might want to ask those early. We'll start with a student who is Connie Ho, and she should be, there we go, 2 students.
Hi.
And Holly as well. So both Connie and Holly are first-year medical students and co-presidents of the Asian Pacific American Medical Student Association here at DGSOM.
Hi, thank you for having us and thank you for having this talk. One question that I wanted to address or pose to you all is I've been thinking about how as Asian Americans, we have also subscribed to the moral minority myth ourselves and desperately trying to assimilate, to adapt, and to keep our heads down and to swallow our pains. And we therefore do also own a role in the upholding of white supremacy. So how do we address this anti-Blackness that persists in our Asian communities, and how can we build unity between communities of color instead? And to follow up with that, how can we also empower our communities to move away from silence and to embolden our communities to be vocal when our voices have historically been blunted by the model minority myth, by our cultures, and by other forces?
Well, I can start. So when we look at Toni Morrison's essay on racism and immigration or immigrants from 1993, she says the fastest way to acculturation or assimilation into the fabric of American society for immigrants is essentially to demonize African Americans. And so we know that Asian American community members do this, like our European counterparts in coming to the United States. She points out that immediately there's an understanding of racial hierarchy and then an alignment with white communities and white individuals. And so I think that's something that happens very frequently in our communities. And one thing we neglect to understand and remember, it is only because of civil rights leaders in the 1960s that many of us are even here in the United States. Speaking personally, my parents, who are both physicians, and I were able to come to the United States because in 1965 and 1966, civil rights leaders did not simply rest on their laurels after the passage of the Civil Rights Act and the Voting Rights Act. They said that they wanted to get rid of racial barriers in immigration. And it was because of that that we had the Immigration Act of 1965 that for the first time in 100 years opened up immigration to those of us from Asian countries. And so I think we need to really think about that and essentially work to pay it forward, rejecting all notions of anti-Blackness, speaking out for and on with our African-American sisters and brothers, and also our Latinx sisters and brothers, because I think together, marginalized communities in the United States have so much in common. And I think when we think about those commonalities and how we together need to fight white supremacy, I think we can begin on that journey toward a more equitable society.
And if I could just add one more thing to what Manju said, I totally agree with everything. I think there is a certain amount of kind of timidness about really getting out there and going to a protest, or you know what I mean, being seen on TV and speaking. I was like that too. You know, I grew up that way. And so I think what you're doing as students and organizing other Asian American medical students is really, you know, those are the places it starts, and to really talk to one another about what kinds of actions that, you know, you can take and take in solidarity with, you know, BIPOC counterparts, because I really think that that true racial solidarity from white to, you know, across the full spectrum is really necessary and happens best when you're working together around really concrete things that you could tangibly change. And I think by seeing the results of organizing and mobilizing, you know, it's kind of like, you know, baby steps, right? Then people, you learn a lot about what it is that what it takes to make change and how to do it. And through that, gain more confidence about your own feeling of agency and the power of solidarity. So I always tell people to start where you're at, organize, you know, where you are. And I think you'll do wonderful and very important things. And thank you both for, you know, your leadership to this organization.
I also just wanted to echo, Connie, part of your question, I'm so glad you mentioned that, is because I personally feel that a lot of members, including myself, of the Asian American community have been silent around anti-Blackness and Black violence for a long, long time. And I think that one of the ways that we change this is we start to disrupt these narratives. So our country has built this narrative first on African-American populations and this idea of impurity or inferiority. And with the Asian American population, it's been about foreignness or outsiderness. So the African-American history is interwoven with US history, but Asian history has always been looked at as foreign or outside of that. And the only way that we stop that is by really recognizing the common denominator hurting both groups is white supremacy and institutional racism. And those are the things that we need to tackle together, because like the incidents in Atlanta just showed us, we are all affected by structural racism and white supremacy.
Thank you.
Thank you all for your insights. I just want to I just want to add that yesterday, the SNMA, the Student National Medical Association, which is consisted of underrepresented and minority medical students, actually reached out to APAMSA to demonstrate allyship to together kind of in the wake of this uprising and anti-Asian racism to come together and empower each other. And I also have a question for the panelists, and it's more action oriented. So we talked a little bit about the stigma against mental health, and we know that in the wake of this uprise in anti-Asian racism, a lot of the community members are anxious and fearful of even going out, and that added with historically AAPI community voices have been usually blunted, has led to a lot of vulnerable communities such as the elderly and immigrant populations to just kind of silently suffer, to just not come out of the house. So I'm wondering, how can we students, policymakers, community members, and children of these communities to help with this situation and empower them?
If I could say something very quickly, which is that your point is so important, both in terms of what we can do to encourage our friends and family members to seek help, make sure that resources are available in our local communities. And I do want to point out that a number of the coalition members of APCON are actually mental health providers. And you can go to our website to find the ones. They serve all parts of the AAPI community. The other point that I want to make, though, is we've been in touch with the folks on the ground in Atlanta, and I can tell you these are exactly the type of resources that are needed. Oftentimes the media and policymakers think that it's law enforcement, and I will tell you, not only families, but also the community in Atlanta is saying, no, that is not what we need right now. We need health resources. We need mental health resources. We need materials and help in language. We need those support systems. We need legal help. So I want to just encourage all of us to think very broadly, and all of you as healthcare providers, that solutions must be comprehensive as we move forward, and that we're not going to police our way out of this problem. That law enforcement is not the only tool in the toolbox, and that each and every one of you plays a role in how we help communities right now to address the hate and to move forward to a place where all of us thrive in 2021, in 2022. And I do hope that this is an opportunity that we use to galvanize our young folks, our medical students, and all of those, even adults like me, to be involved. We need to be civically engaged. We need to demand action of our policymakers moving forward, because that's the only way we are going to get out of this. And so I would encourage each and every one of you to engage also in that process beyond even the confines of the medical center and your daily work, because that's needed as much as what we're doing with everyday patients and everyday medical procedures.
Great. So I want to make sure that we have time to get to a couple of the questions that have come up in the QA. And Yulin asked for me to ask this question on you's behalf. So how do we respond to well-meaning individuals that say that Atlanta murders can't really be considered a hate crime or act of racism until, quote unquote, investigation is complete? Is there any interest in lawmakers in improving the recognition of AAPI hate crimes more swiftly?
I'm not sure if I understand the latter part. Can you repeat the latter part of the question?
It says, is there any interest in lawmakers in improving the recognition of AAPI hate crimes more swiftly? So in other words, I think the question is getting at, many people are saying that we can't consider what happened in Atlanta to be a hate crime until this investigation is complete. What do you have to say to that? And is there any interest in lawmakers or anybody interested in moving more swiftly and classifying this as a hate crime?
yeah, I don't mind speaking to that. Brandon, I welcome, I look forward to what you have to say about this too. I mean, this has been a debate that we see, you know, in the media right now. And I think I'd like to kind of zoom out a little bit. I think it's a pattern that we've seen. So this, I think there are two separate issues. I think one is how this incident itself kind of resonated within this whole series of anti-Asian violence, and that it's hard to really separate this incident in the mind's eye and in the tenor of the incident from this phenomenon, this larger phenomenon. I think the second thing is that it's really the whole term hate crimes is a very narrowing term, because we're really talking about racialized, sexualized violence. And I think if we look at it in those terms, it's hard to dispute the fact that there's a racialized and sexualized nature to what happened, and that this is tied to a whole history of, say, US empire in Asia, the sex industry that gathered around military bases, the importation, the sex trafficking that takes place, that has been taking place, that has really gone under the radar in many realms, and the sexualized, fetishized nature, right, of the massage industry. And not all the massage industry is not a sex industry. I think that's also an important point to be made too. But who's doing this labor, and why are the groups doing this labor? So I think there are like bigger issues that are raised, and this fight over, is it a hate crime or not a hate crime, really kind of washes over these bigger issues that I think we really need to confront as a society. So I'll leave that legal debate up to lawyers, but I'd love to have more engagement in these broader issues of import.
I similarly cannot comment on the legal aspect of it. In terms of, just to make a point about the mental health aspect, based on the narrative that's been out there. So as a mental health provider, sex addiction is not an acceptable explanation for an act of mass murder. Having a bad day is not an acceptable explanation for committing mass murder. If we ignore the race and gender and even socioeconomic status of the victims involved, to ignore that and is just both naive and insulting. Like Dr. Umemoto said, it's built upon this long history of the commodification, the hypersexualization of Asian American women, combined with misogyny. And so to not call it a hate crime of some sorts is to be naive to both the historical patterns and the actual events that occurred.
Yeah, if I might, Julian, just add a comment. I just really, just to amplify what you both said. As I listen to the news accounts and sort of the hedging on this, it's deeply disturbing, because it really demonstrates the depth and American culture of what you're talking about. I heard a commentator talking about this, responding to this question, who made a fabulous point, which would be to imagine that the same horrendous act had happened at a synagogue. You don't think anyone would be asking, was that anti-Semitic violence? There would be no question, because it would be obvious. But I think the depth of what you're talking about is really, is really revealed by these kinds of responses in what would seem to be well-intentioned, middle of the road kind of media. It's just really been quite striking and quite disturbing.
Thank you. So I have one last question, and then I want to transition us to generating action steps that we can take to counteract anti-Asian racism. This last question is for the researchers who might be in attendance and is actually submitted in advance. People are wondering who are in research roles, what are the implications for their work? How can they counteract anti-Asian racism, harassment, and violence as researchers? What are some of the things that they should be thinking about, considering as they design and undertake their studies?
Brandon, do you want to go first? Or?
Yeah, by all means.
And Dr. Braddock, feel free to chime in here as well.
There's so much research to be done, it's overwhelming. I think the area of racial violence is so complex, and there's so many aspects to it that need to be researched. There's so many different types of racial violence. There's violence that originates more from white supremacist organizing work. And then there's racial violence that's associated with, crimes of poverty, as they say. And then there's racial violence that has to do with economic competition, right? In the illegal, markets or illegalized markets. So there are different types of racial violence, and I think we tend to lump them all together. And I think we need to kind of disaggregate the types and to more deeply understand what the root causes are that lead to different types of racial violence. And only then can we better address the problem. I think this, my fear right now is that the call for stricter hate crimes legislation is being seen as kind of the silver bullet to solve all of these problems, including the underlying problems. And I think that's really dangerous, because what's going to happen is that we're going to see greater criminalization of BIPOC and people of color, basically. And so I think I would encourage those interested in doing research and those interested in doing research on racial violence to come together, and let's figure out, how we can kind of parse this field in ways that we could complement one another, and then inform the different strands of research, in a fuller way. So I really appreciate that question. Thank you.
I'll just add quickly. I think this is a bigger conversation about race and its role in research more broadly. The question being, what are we using it as a surrogate marker of, and what is the utility of that, and what story are we trying to understand? I think disaggregating the Asian American population, like we talked about, from one another, instead of this expecting it to be this large homogeneous group, is one piece. But then also understanding or also remembering that, especially in the mental health field, that we are looking at this from a westernized frame, which doesn't map on very well to Asian cultural beliefs or traditions or concepts of mental illness. And so we need to also figure out how do we create questions that are both culturally appropriate, looking at the populations that we're actually intending to study.
I just briefly would add, I agree completely with what you both said. I think particularly, Brandon, on your point about, the message for researchers more generally is, the long tradition of the misuse of race and ethnicity as a proxy from some biologic phenomenon, which, there are many, many examples of that. And I think researchers, it's just, always been deeply troubling to me that you pick up even today any medical journal with any kind of clinical trial or the research findings, always in table 1 will break down the results by race, ethnicity, which further perpetuates this notion of race as a biologic construct and reinforces racial differences, which I think in many ways reinforces white supremacy. The second thing is I think that the failure to recognize racism as a health determinant is something we just have to figure out a way to transcend. So the conceptualizing race through the lens of socioeconomic status or homogenized views of cultural beliefs just doesn't, it skirts around the fact of racism and the effects of racism per se on health. And my message to researchers, if you want to explore the health issues for people of color communities, then you need to be thinking about how to conceptualize racism in that work.
Thanks for that. So we're gonna transition to generating some action steps. I'm gonna invite my colleague Dana Schmitz, who's on the screen now, to share a Word document or template that she has created just to capture some of the notes from this discussion. There are a couple of questions in the chat box that I do want to make sure we address, and I'm going to try to address them in the context of this action step generation. So the top upvoted question at this point is, what's the best way to deal with a patient who is making racist comments, but you still have to treat that patient? So I invite the panelists to respond to that, but also if there are attendees that have ideas, I believe that we'll activate the chat box soon if it's not already activated, and you can type in your ideas there.
Well, I'll start in with something we've been talking a lot about at UCLA Health, really updating our sort of guidance and recommendations, and it's something there's a lot of literature on. I think the fundamental question is how do you maintain one's sort of professional obligations to patient care while at the same time indicating that you're not going to tolerate racist comments from patients. I think it's a dilemma in the setting of particularly patients who are acutely ill. But when things are not so acutely ill, there are a lot more choices. Our policies really at UCLA Health really revolve around very clear expectations of what we will or won't do. We won't allow patients to decline, for a particular clinician based on race, ethnicity, or gender, or sexual orientation, or any other categorization. And in the case of if those views are held, then the patient has the right to kind of go elsewhere. That may sound a little bit harsh, but I think that we have an obligation to again, in the setting of emergency care, to provide due care to stabilize the patient. But I think in other settings we really need to try to just indicate our values and be very clear with patients what we will or won't do.
Thanks. I just sent out a message to everybody that the chat feature is activated in case there are other comments that people want to share. The next question is, AAPI make up one of the largest demographics of UCLA's non-academic staff workforce, second to white, but these numbers are dramatically reduced for higher level administrative positions. Would love to hear the panel's thoughts on this, and perhaps ways of breaking what some of us call the bamboo ceiling. So how do we counteract this phenomenon?
I think this is true for Latinos, for African Americans, for Native Americans at UCLA too, in terms of like the top leadership positions, the most powerful leadership positions, and some of the more visible leadership positions. And, this is where bold leadership comes in. I appreciate everything that Chancellor Block has done around rising to the challenge and many other things. And I think continuing to support the diversification of the upper echelons of administration for, to reflect the populations served by UCLA in the region, I think is something that we work for the institution, so it's sometimes hard to, to mobilize more support on the campus for that. But I think this is something that it's not just for the benefit of UCLA, but the benefit of California, to have all of our universities, public universities, reflect the top echelons of leadership, really reflect the population. I think public support is really needed to impress upon that point.
Great.
Yeah, can I just add real brief. I know we're running short on time, but I think it's also, the term structural racism, the structural part of that often refers to rules or traditions or approaches which just perpetuate. So I think just as we've started to really think differently about academic searches and how the search committees themselves need to be diversely represented, that really in any kind of selection process for any kind of leadership position, we have to start there, and how the search committee and the process is structured, how things get advertised. So many leadership positions wind up, there's sort of like the informal part of it where someone is already kind of in mind by that selection process, and then it just perpetuates the same ceiling that you so aptly referred to.
Thanks. I just want to acknowledge the recommendations that are in the chat box. They might not all get captured in the Word document right now, but we will save the chat and add them later. But there are a couple of suggestions, including more intentionality behind succession planning within departments. There's another suggestion around collecting detailed, disaggregated, self-reported ethnicity data from patients. And that's one possible solution that the person is related to dismantling the model minority myth, et cetera. So please continue to share the suggestions if you have them in the chat box, and we'll make sure that we save that. We have a few more minutes left together, and I just want to open up the floor for, I know we talked about a lot today, just to see if there are any other general action steps that people have on their minds that they would like to share. You can either raise your hand and we'll unmute you to speak, or just simply put them in the chat box.
Just one comment I wanted to add to this, how do we disrupt the sort of workflow is, this all goes back to, so you mentioned the idea of intersectionality, which is looking at individual places or identities of power and oppression, and trying to understand, if we are trying to diversify, is it the same to have somebody with an identity of being Asian, say, I'll use Japanese for an example, Japanese American, to be at a higher level of leadership? Is that the same, or is that different than having a person with a Cambodian American identity who has a very different story, immigration story, and different stressors than perhaps mine, outside of just one singular identity? I don't know if I said that very clearly.
Mm-hmm.
I totally agree. I think sometimes people feel like if you have one Asian in there, they represent everybody, but there are huge differences, particularly between immigrants and refugees, for example. I have one more thing to say just about, kind of action steps, which is that, and it's for the university as a whole, and we issued a statement along with Asian American Studies Department and the Center for the Study of Women after the incident in Atlanta. And one of the things that we were calling for was for universities to really rethink their mission and and whether or not we really are, as institutions, preparing the next generation to address the problem of racial violence and inequality in a meaningful way. And if we all think about, in all of our disciplines, how we're preparing that next generation to deal with this problem, I think it forces us to really think about who we're hiring, what we're teaching, how we're structuring the curriculum, pedagogical approaches, particularly community engaged approaches to education, so that, you know, we are really making a difference with the work that we're doing. And just the last thing is, I think there are many diversity committees. There's so many people doing so much good work at UCLA to try to address the issue of racial equality. And I think I think it would be great to have I don't know, lift these efforts up a little bit more so that people across the campus, we're all aware of the various efforts that are taking place. And I would love to see a day when we don't need DEI offices and that we don't need diversity committees, because, you know, we've been able to integrate all of these voices into the mainstream decision-making processes of our institution. And I think that's always, I think, a goal we should always strive for.
Absolutely, yep. So I'll acknowledge two more comments that were made in the chat box, and we have one last live question, and then we'll wrap up. So I'm just looking at a comment that was made earlier, or a suggestion around hanging up Stop Hate flyers throughout the campus, just as a reminder and a stance to make public. And there's also a suggestion about creating a resource about the history of AAPI racism that can help people recognize racism when it occurs, which is another great idea. Our last comment is will be from Marissa, or perhaps it might be a question. Marissa, are you with us?
Yes. Hi, good afternoon. First of all, I would like to thank everyone for creating this forum. I am Asian American, and be truthful, I am terrified as well as confused as to what's going on. My questions are more like, are there safety measures currently in place? Like, for example, UCPD escort, like if on and off campus right now, just, you know, to be prepared if something happens. I know that sometimes, because we're still trying to understand the anti-Asian incidents and all that, and gathering facts in order to be able to have confirmed protocols. But in the meantime, are there some safety measures, like I said, the UCPD escort or notification through Bruin Alert of any incidents that may be happening on and off campus?
Yeah, I'll just say, I just put that in the chat. Thank you for that question. Yes, you know, the UCLA UCPD escort service is, as I hope you know, a 365-day, 24-hour-a-day resource for faculty, staff, and trainees at UCLA who at any time are concerned. The other thing to say is that our campus, you know, our Vice Chancellor for Equity, Diversity, Inclusion, Professor Anna Spain-Bradley, and her office are a resource to report either incidents of that are racial discrimination, harassment, or violence, or through, you know, via Title IX for those based on gender or sexual orientation. And those Vice Chancellor Spain-Bradley is a staunch advocate for to combat these kinds of incidents, and I know their team is really eager to, you know, partner with folks individually and collectively on these kinds of incidents.
Thank you so much.
Thank you. Well, I want to say thank you to all of the panelists who joined us today and for everyone who participated by offering questions or suggestions. This was a really fruitful discussion for me. I'm going to turn it over to Dr. Braddock to close us out. And if the panelists want to offer any closing reflections, they can too. And thank you, Dana, for these notes.
Yeah, first panelists, any closing thoughts for the group?
No, I just want to thank UCLA Health and all of you for putting this program on. You know, a lot of the situation regarding anti-Asian hate is localized. It's different in different localities. And so I would just encourage everyone to continue this conversation. And for those of you in the medical community, to you know, continue the conversation about the particular ways that it's manifesting in your work. And if there's anything that we can do at the Asian American Studies Center, please let us know. And thank you for pursuing this issue in your field.
Thank you.
Agreed. I would just extend appreciation. I think having platforms to have these conversations is extremely useful. And again, the coalitions and the supports from different groups and especially different racial groups has been just really heartening. And the people who have reached out and supported over the past several weeks and months has been exceptional.
Well, thank you both for those closing remarks and for being here today, and you know, your comments and wisdom, I think will stay with folks for a long time. I guess I would end by saying and thanking all of you for coming today. We had at one point 500 some folks today, which I think it's a really honestly for me inspiring to see the level of engagement from the UCLA health community for you know, our continued work. You know, when we started this anti-racism roadmap and the hospital clinic systems HEDI office, not even a year ago, we realized a couple of things. One, that was a way overdue, the level of effort and focus and attention to racism and its impacts on us individually, collectively, on our patients and our communities. I think we also realize that effort is, these events and conversations like this really do advance our thinking and advance our, you know, energize us to remain engaged. But the work, I mean, it doesn't, you know, end here. We have to continue conversations, continue to open our eyes, our minds, and our hearts to the work ahead. When the pandemic started again just about a year ago, and most hospital systems around the world, ours included, put together very significant efforts. You know, we had a command center that met every day. All the leadership, the hospital, School of Medicine, campus met every day to look at data, to make contingency plans, to figure out what do we need to do today to combat the pandemic. And I've thought ever since that's the level of effort that we need, the level of engagement really to combat racism. We're making better efforts now, but a lot more work to do. So I leave you with that I'm deeply grateful for our panelists, deeply grateful to you, Julian, for putting this together along with your colleagues and partners, and to all of you for coming and being part of the conversation. But let's leave today with these great actions, steps that we've captured, but realizing that there's much more conversation on this and other issues. So thank you again for being here. And with that, I guess Julian will call the session to a close.
Thanks, everyone.